So a lot of news has been coming out every day recently, and it can really be hard to keep up with around booster shots and vaccines and what's effective and what isn't. So we wanted to host this session today so that you all had a chance to hear directly from experts in the health department. I know that I'm constantly having to Google what's been approved and what hasn't, and the FDA and the CDC have been meeting to review evidence around boosters and make recommendations for everyone. So my family and friends are often asking questions that I don't know the answers to. So we figured the same is probably true for you. And that's why we're hosting this session today. So thank you all so much for coming. We're really excited to be here. Just going to go over some logistics before we jump in. We have interpretation services today. So to participate in this session in another language, you can press the globe icon on the bottom of your screen, and then you can choose which language you want to have the session in. And we have interpreters in 5 languages here. So thank you so much to our interpreters. We also have an ASL interpreter here that you all should be able to see kind of pinned to the screen. If you can't, then you can type in the Q&A box and we can troubleshoot. But thank you all so much to our interpreters. We really couldn't do it without you. So this session will also be recorded. So we're going to record it and upload it to YouTube so that anyone who couldn't attend can still get the information. And we'll also make sure to send slide decks out after the session. And then if you have questions, we really encourage you to post them as they come up for you in the Q&A box. So we'll make sure to answer questions at the end, or we'll type answers back to you through the Q&A as they come up. So please, we really want you to ask as many questions as you have, and we've built in time at the end of the presentation to answer those questions. There are several people from the health department here, in addition to Dr. Epstein, who are here to answer those questions, including Kiara Benson from the immunizations program. So thank you to everyone from the health department here, kind of working behind the scenes to make this possible. And so I'm going to go ahead and turn it over to Dr. Shara Epstein. She's an infectious disease specialist who's the medical director for the Division of COVID-19 Containment here in the health department. And we are happy to have her here answering the many great questions that you all already submitted through registration. So most of these slides are based around those. And then any other questions that come up, we'll make sure to answer.
Hello, and thank you for having me. Like Emily said, there's a lot of new information every day, especially this week, actually, coming out about booster shots. So we'll talk a little bit about all of that today. So we'll start with what a booster shot is. And a booster shot is just an additional dose of vaccine that helps your body's immune system be ready in case you get exposed to a particular disease like COVID-19. Many of the vaccines we get through our lives require booster doses. For example, most of us get a tetanus vaccine about every 10 years, or whenever we get possibly exposed to tetanus. That's a booster that you're getting then. Pregnant people get a pertussis vaccine during every pregnancy. Again, that's a booster to help prepare your body and kind of remind your body to be prepared for those diseases, those infections. So there's, like I said, a lot of information coming out about booster doses from the FDA, from the CDC, about for COVID-19. So I wanted to just start with a little bit of terminology because it is very confusing. So what's the difference between a booster dose and an additional dose? The CDC, the FDA authorized and the CDC recommended additional doses, so third doses of either Pfizer or Moderna vaccine for moderately to severely immunocompromised individuals. And that's for people who finished their vaccine series just at least 1 month prior, at least 28 days prior. And the reason for that is that the initial 2-dose vaccine may not be fully protective for immunocompromised people. We know that the immune system in immunocompromised people may not respond as well to vaccines. So an extra additional dose can help protect those people. A booster shot is different. It's given further out, and it's advised for a wider variety of people. So who should get a booster shot? Right now, the only FDA authorized and CDC recommended booster shot is for the Pfizer vaccine. We'll talk a little bit more about that in a minute because that's about to change. But right now, as of today, only people who have received Pfizer vaccine for their primary series, so their first and second shots, are eligible to receive a booster. And those people can receive a third dose of Pfizer, a booster of Pfizer, at least 6 months after they finish their initial series, their initial 2-dose series. And the people who should really get a Pfizer booster are those who are 65 and older, those who live in a congregate setting like a nursing home, those who are 50 to 64 years old with an underlying medical conditions that put them at risk for serious complications of COVID-19. So that's a large group of people who should get a booster if they received the Pfizer vaccine at least 6 months ago. Now, who else can get a booster? The FDA and CDC went a little further and said that while those first two groups of people who got Pfizer should receive a booster, there's another 2 groups of people who may want to receive a booster after discussing it with their healthcare provider. And those are people who are 18 to 49 years old, who have underlying medical conditions that put them at higher risk of severe disease if they get COVID, and 18 to 49-year-olds who work in high risk, anyone 18 or older who works in a higher risk job like a healthcare worker, a teacher, or anyone else who regularly comes into contact with people that they're not sure if they're vaccinated against COVID. So those 2 groups of people can receive Pfizer boosters. It's important to note that Pfizer vaccine is authorized for anyone 12 and older, but the booster is only authorized for those 18 and older in these groups here. So what about Moderna and J&J? A lot of people have been feeling left out. Pfizer, they didn't get Pfizer in the first place, and they're wondering when they can get a booster. So this is all rapidly changing. The FDA Advisory Committee met last week and evaluated both boosters for Moderna and J&J. So for Moderna, the committee recommended a half dose of the Moderna vaccine for the same groups of people that are recommended to get the Pfizer vaccine booster. So those over 65, those who are 50 to 64 with medical conditions, and then those other groups, 18 to 49-year-olds with medical conditions can consider it, and those people who have high-risk jobs can consider it as well. And this is, again, for people who completed their initial series, so their initial Moderna doses at least 6 months ago. The committee also evaluated J&J. People who have received J&J for their first vaccine have been feeling very left out. They received only a single dose initially. So the committee recommended that anyone who got J&J that's over 18, so really anyone who received J&J for their first vaccine should be eligible for a booster dose if they received their first vaccine at least 2 months ago. So that doesn't have any qualifications for health conditions, jobs. That's anyone who received J&J at least 2 months ago should be eligible for a booster dose. So the FDA advisory panel discussed that and made those recommendations last week. The FDA will be meeting tomorrow to authorize, and then the CDC, the the immunization advisory committee from the CDC will meet later this week to decide how to implement those recommendations that the FDA is authorizing. And then mix and match vaccines, even more breaking news only this week is that the FDA will vote on whether to allow people to get a booster with a different vaccine than the primary series. So that would mean someone who received Pfizer could receive Moderna for their booster, someone who received J&J could receive Moderna. And there's some evidence that various kind of mixing and matching regimens can cause an increase in antibody levels and thus possibly protect more against disease. So what does this mean? Why do we have to get a booster all of a sudden? We've been talking about how protective these vaccines are. Does this mean that the vaccine won't work without a booster? Does everyone need to get it? So it's important to remember that the vaccines still provide very strong protection against illness, hospitalizations, and death. Severe illness, hospitalizations and death. The vaccines are still very good, even with just the primary series, so just the initial 2 doses or 1 dose of J&J. But severe illness isn't the only thing we care about. Even moderate illness can, take you out of work for a pretty long time, make you feel pretty terrible. And then, of course, we want to protect against spread however we can. So those are some reasons to get vaccine. And then especially in older people who are at really, greater risk of getting severe COVID and being admitted to the hospital, any protection, any extra protection is a good thing for those populations. So, the vaccine is still good. Nobody's required to get a booster, but it can really protect certain people, certain groups of people. And this is a slide that I stole from the CDC, but I just wanted to show that you can see the blue lines are unvaccinated people and the green lines are vaccinated people. And these are rates of hospitalization. So those green lines down at the bottom are the hospitalization rates for people who have been vaccinated. They are really low, even without the booster, they're really low. And the blue lines are hospitalization rates for the unvaccinated, and they're much higher. But you can see the difference once you get to the older age group, greater than 65 years, the protection's not as great with the vaccine. You only have 13 times protection as opposed to more than 20 times protection. So that's where the booster can really come into play. So I wanted to talk about whether booster doses are required to be fully vaccinated. There's a lot of mandates, a lot of requirements for employment of vaccination. Right now, the CDC hasn't changed its definition of fully vaccinated. So any individual who's received 2 doses of Pfizer or Moderna or 1 dose of J&J is fully vaccinated. You don't at this point for any Philadelphia requirements or any federal requirements that I'm aware of need to get a booster to be considered fully vaccinated. Side effects of the booster dose are really the same as the side effects of the initial doses. So some common side effects are pain and swelling and redness in your arm, and sometimes feeling kind of worn out for the next day or two, tired, headache, muscle pain, chills, fever, and nausea. Some serious side effects, especially those that we saw initially with the J&J vaccine, which were very, very rare. were even more rare, less common with the booster dose than the initial dose. So we're really not seeing anything concerning with the booster doses in terms of side effects. And then lastly, as we're entering yet another exciting season, we have
Có
not
thể
just
lấy
COVID
được
to
mũi
worry
chích
about
ngừa
right now,
phòng
but
cúm
also
và mũi chích ngừa
flu
tăng
coming. And there's a question about whether you can get a flu shot and the COVID booster at the same time. And the answer to that is yes. You may remember that initially the recommendation was to not get a COVID vaccine within 2 weeks of another vaccine. But now that we have months and months of data and millions of people have received COVID vaccines, we feel very confident that it's safe to get it at the same time as another vaccine. So if there is, if it's more convenient for you, you should certainly get both your flu and COVID booster at the same time. So with that, I'm going to turn it over to Emily to talk a little bit more about getting vaccinated in Philadelphia, and then we'll take some questions.
Thank you, Shara. That was great. So as a reminder to everybody, similar to when you got your first or second dose of your vaccine, you do not need to show ID and you do not need to share a social security number or proof of immigration status in order to get the vaccine. You also do not need to show your vaccine card or a photo of your vaccine, or you do need to, sorry. You do need to show your vaccine card or a photo of your vaccine card on your phone to verify that you received your second dose of the Pfizer vaccine at least 6 months ago. And as a reminder, booster doses are free, the same way that the initial doses that you got were free. So some of you may be wondering what to do if you lost your vaccine card, which is not uncommon. So if you have lost your vaccine card, you can request it by visiting the link in this slide, which we'll make sure to send out after the presentation. And you should just be prepared to attach an image with proper photo ID to the request. And then also there's been some questions for people who have gotten their vaccine card laminated. You can still use it if you go to a city clinic, a vaccine clinic that's run by the city. Our staff will place a sticker to show that you have received your booster dose directly on the laminate. And many clinics will be able to replace your card altogether. So that shouldn't be a reason that you don't get the booster. So where should you go to get a booster in the city of Philadelphia? Booster doses are available wherever Pfizer vaccine is available. So for some of you, that might mean the same place that you got your first doses might still be offering vaccines and you can go there. If you're looking for a location, you can always visit our website. So this is the first time I'm going to plug the website, but it's not the last time. You can go to this website or you can call our call center, 215-685-5488. Or you can email covid@phila.gov with any questions that you have. And all of those are great resources. Our call center is fully staffed and we have people that kind of know the landscape of vaccine all across the city and can help you find a clinic near your home or work and make sure that you're able to get the vaccine. And also we have help and options to help you get to your appointment. So you can get SEPTA transit passes. These are free round trip passes that are available at all city-run vaccination sites. So we encourage you to take advantage of these. If you go to your vaccine appointment and once you get to the appointment, you can get the passes, and you're also eligible to get like reimbursement passes. So if you got there and you paid to take a SEPTA there, you can get 2 passes to cover the cost of your initial trip. So we're really excited about this and want more people to take advantage of it. There's also SEPTA CCT. SEPTA CCT has expanded services for seniors, individuals with disabilities or functional needs, or anyone who requires assistance getting to and from city-run vaccine sites. So if you want to schedule a ride with SEPTA CCT, you can also call our call center, 215-685-5488. And then finally, we have a partnership with Lyft. So Lyft is offering free rides to vaccine appointments for any Philadelphia residents who need them. So this is also a really great service. Lyft is similar to Uber. A car will come to your house and take you right to the vaccine appointment. And you can call 215-586-3006 to schedule your ride, or you can call our call center if you need services in Spanish. We also have a great resource for homebound vaccinations. So this program is available for any individual who is homebound or anyone who has difficulty being vaccinated at a clinic due to a disability. And in addition to those individuals being eligible for this program, personal care attendants, family, and any other caregivers of the individual's household are also eligible. And we'll make sure to share this link that's listed in the slide as well. And as always, you can call our call center to get that set up too. And then just one final plug for our website, which has a lot of great information, not only on vaccine, but also on the guidance that can be changing pretty regularly. There are blog posts that explain guidance, and there's also a map of testing sites and vaccine sites and a list of events. So it's a pretty comprehensive website that has a lot of information. And then I just want to highlight some upcoming vaccine events for you. So these are coming up on October 21st and 22nd, and these are just a handful of them. These are ones that are run by the city. So we talked about kind of the SEPTA passes and the perks of that. There's ones on October 21st and October 22nd, Grand Yesha Ballroom, Pascoville Library, Salvation Army, and the Logan Library. And again, this is just a handful. There's a lot. So I really encourage you to go to our website to find one that's near your home. And the same goes for testing. You know, a lot of talk about vaccines, which are really important and an important tool in protecting yourself. But testing also is important. And I know a lot of people, there's been a lot of demand for testing lately. So we have 2 mobile testing units that set up around the city from Tuesdays through Saturdays. And so you can, again, find the schedule for that on our website, but upcoming events are on October 21st and October 22nd. So that's this week. And they're open from 9 a.m. to 1 p.m. So encourage you to find those if you're interested in getting tested. And then we'll jump into questions here. I know there's been a decent number of questions that have come through, which is great. But I just also want to remind you before the session ends, we have plenty of time here, but before the session ends, once it ends, there will be like a little 4-question poll that pops up that we would really appreciate if you could complete to just let us know how the session went for you, if there's anything we can do better, and kind of also what your thoughts are on booster shots at this point. So I'm going to go ahead and stop sharing my screen so I can see what questions have come in. Let's see. Okay, let's see. So Shara, there are some questions here about for individuals who have like underlying conditions or might be immunocompromised, kind of specifically addressing when they should be getting the booster shots and why it's important. Again, I think you mentioned it at the beginning of the presentation, but it's worth saying again.
Yeah, so those people with immunocompromising conditions, moderately to severely immunocompromising conditions, should receive their additional dose of Moderna or Pfizer vaccine 28 days after their original original series. So they don't have to wait very long and should really get that extra protection soon. The other medical conditions that put you at high risk for severe disease that are in those booster categories, the 50 to 64-year-olds and the 18 to 49-year-olds who are at risk for severe disease with COVID, is really a wide variety of people. The CDC has a list, but it includes things like diabetes, obesity, heart disease, a variety of really conditions that put you at increased risk for severe disease. And if it's helpful, we can send out that list of conditions. But those people should receive their booster at least 6 months after their initial series.
I think a question kind of going off of that is pregnancy still a concern for getting vaccinated?
So pregnant people should definitely get vaccinated. There is good data showing that people who are pregnant are really at much higher risk for severe disease than the general population. So this is incredibly important for people who are pregnant, and the vaccine is safe in pregnancy. So, and if it's been at least 6 months since your initial vaccine series, you should definitely get the booster if you're pregnant.
Great, thank you. And then there's questions around if someone has tested positive or gotten COVID, do they still need a booster, and how long after they test positive should they get the booster?
Yeah, that's a good question. When you've had the vaccine and also tested positive, you have pretty good immunity. The problem with getting counting on your immunity after you've been infected is that it's not very consistent. We can't say like your immunity is this much after you've been infected. So you really should still be vaccinated, even if you've been infected, and you can get the booster as well. You just need to wait until you're outside of your infectious period, the time when you should be isolating. Of course, you shouldn't come out and get your booster, but anytime after that is fine.
Great, thank you. And then have there been any thoughts, or have you heard anything around if another booster would be recommended, like after this booster for however many months later?
Yeah, it's certainly something people wonder about. We get flu shots every year. I think we just don't know yet. We're not far enough out. I don't anticipate that it'll be every year, but it's possible. But I don't think it'll be, in another few months that you'll have to get another booster or anything like that.
Okay. And then this is kind of related and might not be something that we have the answer to right now, but worth asking. Will there come a time when everyone who wants a booster will be able to get one without kind of falling into the immunocompromised or other designated categories?
Yeah, I don't have an answer to that right now. We'll have to see what the research shows over the next few months, and how good the protection remains from the primary series.
Great, thank you. And then Kiara, this might be a question for you around kind of how to classify someone who works in a high-risk environment, like whether a restaurant worker would be considered high risk.
Sure. I think the CDC also has a list of high-risk examples of high-risk settings. So I think if you are curious about whether or not you fall into that category, I'd recommend taking a look at that list online to see where you fall.
Thank you. And we can send out links to these things that we've been referencing, so you all have them in the email that we send out. Okay, Shara, I think this is a question for you. Is the booster and third dose, is that the same vaccine? Is it like the same amount of vaccine?
Yeah, that's a good question. So for Pfizer, yes, it's the same. For Pfizer, it's the same dose and it's the same vaccine. For Moderna, it's the same vaccine, but it's half the dose. And that's really because the protection from the Moderna vaccine at the initial dose was not shown to be really waning that much. It was still very protective. So they recommended a smaller dose, but it's the exact same vaccine in a smaller dose. And the J&J booster is the exact same vaccine as the initial in the same dose.
Great. And then I see another question here kind of about the specific underlying health conditions. And we can, I think the best way to answer that is just to send you a link to kind of the CDC classification. So we'll just make sure to include that in our follow-up. There's a few questions here about the difference in effectiveness between Moderna and Pfizer. Can you speak to that?
Yeah, so they've both shown to be very protective, but there does seem to be, this far out now, a bit more protection against severe disease with the Moderna vaccine. The Pfizer is still very good, but the Moderna does seem to be a bit more protective at this point.
Thank you. And then Kiera, I think this would be a question for you is, do you have to show proof of an underlying medical condition to receive the booster shot?
I think different sites are going to have a different way of how they gauge who's eligible and who's not. Most of the sites are going to be using a self-attestation form where you'll just attest that you have an underlying condition or that you fall into the qualifying criteria, but that's going to be site dependent.
Great, thank you. Okay, let's see. I think we've answered most of the questions that have come in here. There's actually been, so this one just came in that I think you touched upon in your presentation, but worth repeating also, is around mixing and matching, and kind of if someone got the Johnson & Johnson, and I know, yeah, you can talk a little bit about where the FDA is in that process.
Yeah, absolutely. So I believe it's tomorrow that the FDA is going to kind of make a decision authorizing the mixing and matching. And then the CDC will meet later this week. And if I get those dates wrong and anyone on this call wants to correct me, feel free. But there was one study that showed that protection, antibody level, which does not necessarily equal protection. Our immune systems are really quite complicated, and antibody level is not the only thing we should be thinking about. But it is one marker of protection, and antibody levels increased much higher if you got Moderna after J&J as compared to J&J after J&J. So there may be people who decide to go that route if the CDC does recommend it later this week. We'll have to wait and find out.
Yeah, so I guess there's a question that follows up on after that, which is if you're eligible now for a Pfizer booster shot, would it make sense to wait for word to get a booster from one of those other manufacturers?
I think that's something you can discuss with your healthcare provider. I think, any option is good. It's only a couple of days, so a month ago, maybe you would have, the right decision would be just get the Pfizer because that's the only one available. At this point, any option is going to be a good option. I don't think there's a right or wrong answer there.
Thank you. Let's see. These are all great questions. Thank you so much for asking these. I think maybe this is a question for Kiera around whether family caregivers would be eligible for boosters if they care for seniors but are not immunocompromised.
So that's a good question. I think that would just depend on how you categorize the risk of exposure. If you have a higher risk of exposure due to your work setting, and there are some people who get paid to be caregivers. So if you think that puts you at a higher risk of exposure, I think that'd be something you want to discuss with your healthcare provider.
Great, thank you. Okay, I think we're in pretty good shape as far as having answered the questions that have been asked, we'll go through and save this and make sure that they were addressed. And in past info sessions, we've sent out kind of a Word document with an FAQ, and we'll make sure to do that for this one as well. And again, this will be recorded, so we encourage you to kind of share this with friends and family if they have questions, and just keeping in mind that the information is changing quickly and every day. So it's important to kind of stay up to date. And we'll also include a link for you to register for our newsletter and for our listserv. So we'll try to send updates out through the listserv as they come around the booster shots and the recommendations. So I think, yeah, we went through a lot. We covered a lot in a short amount of time. So thank you so much, Shara, for being on, and thank you everyone for attending. And please remember to fill out that poll that will pop up once you end the session, and then also just look out for our next info session, which will be sometime in November. So thank you all. Have a great rest of your day.